My next guest, Carla Radka, is President and CEO of Senior Resource Alliance. Together, we'll discuss how the agency collaborates with the community to serve our senior residents. Tell us a bit about yourself and the Senior Resource Alliance.
Senior Resource Alliance is a wonderful organization that serves as a safety net for seniors and caregivers in Orange County and for our neighbors in the District of Commissioner Bonilla. We are very proud to offer many services, including Meals on Wheels programs through different meal sites, and also daycare services for individuals that might be living with dementia or Alzheimer's, to be able to give them a break to caregivers and be able to be on a safe and secure space. Those are among some of the services that we offer. But we also have a wide variety of services that include wellness workshops as prevention to live a better quality of life for seniors, on how to manage disease, how to be able to prevent falls, Tai Chi classes, and so many other services that I will be very happy to be able to share with our neighbors and friends from Orange County.
And how does the Alliance work with other local organizations to offer a comprehensive support system for seniors in Central Florida?
The work of Senior Resource Alliance in our community definitely cannot be done alone. So we relied on a large network of providers on the aging care community. And those are some of the organizations that we actually fund, like Seniors First or Share the Care in Orange County, among others. And then outside of that, our network is built around the county, the Orange County, which have provided incredible support, especially during the pandemic, to provide meals and education for seniors on how to be safe and healthy. So it's through a large network in our community that we are able to bring those services through Central Floridians. One of the main services that is very important and is the point of entry into our system of care is the Elder Helpline. Through the Elder Helpline that operates as a 211 for information or 911 for emergency, our Elder Helpline provide information and referrals for caregivers and seniors that are in great need of resources and referrals. And traditionally, individuals will not find us just because they happen to want to call our Elder Helpline. Traditionally, families and seniors contact us because there has been an incident in the life of a senior. Maybe a grandfather doesn't look as agile and start forgetting information, or maybe grandma looked thinner during the holidays than in previous visits, or maybe someone had a fracture or an emergency visit. And that is when individuals in Orange County contact us to be able to find information and referral on how to best care for seniors. So it is a safety net, it is a point of entry, it is like the to-go place, and what we call the heartbeat of our organization too, where dedicated counselors and individuals are there to provide guidance and directions to individuals that are in crisis or in incredible need.
What is the most common requested service that you receive?
Among the most common reasons for that individuals may contact us is actually housing or assistance with nutrition. Those are for the seniors that are at the most vulnerable areas in our community. So housing and nutrition and meals. And we support them, we refer them to the right and appropriate resources that we have available through our network. And the individuals that we have working in our front lines are passionate, caring, compassionate, relentless individuals that really support seniors with those services that are needed in our community.
How can seniors make sure that they are making the most of your services?
I think that one of the important aspects to be able to reach out and understand what we do and how seniors can best and maximize the services that we offer is by reaching out through our elder helpline. And from there, they can be scheduled to have an intake. And through that intake, there is a series of many questions to be able to identify what the needs are. And it depends on where they are. The best way to really understand our system of care and maximize the benefits of our organization is by calling our elder helpline number. And from there, seniors can be scheduled an assessment to identify what needs and where we can actually support them to live a better quality of life, to live a life with dignity and respect, and to be able to match them with the right resources in the community. That is the best way to actually reach out to us. And then to have that one-on-one interaction, usually that's about between 1 hour and an hour and a half appointment to be able to have a better understanding of the situation and where we can go ahead and support seniors with their needs.
Yes, that definitely is a good appointment that you're having with them. An hour and a half. It seems like a really good time to get to know them and what their needs are without rushing them.
That is very important, to be able to match that pace and not to rush anything, especially because when it comes to serving seniors, there might be that concern about privacy or respecting their own space. And so just create that safe space where information is kept confidential. It is discussed in a very safe environment to be able to protect their confidentiality and to use that information for the right purpose, which is to guide them and direct them to services that will improve their quality of life. We want to be able to ensure that our seniors are living on the best way possible, and that those years that they have are in a way that is live to the best of their abilities. Some seniors may just call because they want to volunteer in the community. Some seniors may just call because they want to be able to find exercise classes or a place where they can go and play bingo or dominoes. And some may call us because they don't have any food on the refrigerator. So the services varies. Some calls may come from social workers, from hospitals or relatives, because seniors need a place to go after they leave the hospital, assisted living facilities, recovery places. So the needs are varied, and we take each situation as unique to be able to provide the services that are needed.
Is there anything else that you would like to share with our viewers?
I would like to inform the community that we have expanded our services, and post-pandemic, we continue to provide support to ensure that our seniors are well taken care of and they have the right tools and the right information to protect themselves. And through that, we have a new initiative where we have an AmeriCorps program where we have a large number of volunteers that are deployed in the community to be able to support seniors with mental health initiatives, with services to prevent any infections or any protections related to vaccines. And services and post-pandemic has been added, including grocery shopping or food pantry groceries that are delivered through a cart line. Very soon, we're going to have a book drop-off where we have a large amount of books, 16,000 books that it will be distributed in the community for seniors to be able to read and enjoy on their own space. Life and work balance is important, and the quality of life of seniors is of great interest for us.
And how can people learn more and stay in touch?
So the best way to stay in touch is either through our elder helpline, and the number is 407-514-1800, or through our website, and our website is www.seniorresourcealliance.org.
Oh, thank you so much for taking your time to interview with us and for all the work that you're doing for us seniors.
Thank you for the invite, and thank you for your servant leadership and for all the amazing work that you are doing on behalf of seniors, caregivers, and residents of Orange County. I hope you have a great day.
You too. Thank you.
Take care.
If you're enjoying this show, please subscribe to our channel and follow our Instagram, Facebook, and Twitter accounts.